Hi, good morning, everyone. Welcome to our next session at Generation Superhealth Clinic Conversations. I'm Zsofia. I am the founder of Generation Superhealth Clinic, and I'm here with Agnes, our co-founder. She's a registered nutrition therapy practitioner, a registered nutritionist, functional medicine practitioner, certified microbiome analyst, and healthy gut practitioner, as well as a cyber doctor. I am going to let her speak about one of her favorite topics, which is perimenopause, and an example of a client in perimenopause.
Thank you, Zsofia, for the introduction. And yeah, today's topic is about a client who is in perimenopause. I think many of you can relate to her case, so that's why I have chosen her. Let's name her Sarah, and she came to me at the age of 45. She was a busy marketing director with two teenage kids at home, and the kind of woman, and obviously a husband, and the kind of woman who is always managed everything, her career, family, social life, uh, without breaking a sweat. And then things suddenly started to shift.
What happened with her?
Um, she started waking up at 3 a.m. almost every night. She was
Mm.
wide awake, heart racing, mind going 100 miles an hour, and she couldn't go back to sleep. So that was the first sign. Then the weight was creeping on, especially around her middle, so the belly fat, which is very typical in this perimenopause phase. And despite that her eating was the same, he didn't do anything differently. And then brain fog, irritability, this constant feeling just not being herself anymore. So that's what she told me at the beginning.
Mm. That sounds like a lot, even to listen to it. And I imagine she's been to the doctor before.
Yeah, obviously that's where everybody starts, which is a
Mm.
good start. And they ran all the tests, full blood count, they checked the thyroid, the blood sugar, hormones, and it all came back within range. So she was told that she is fine, maybe perimenopausal, and stress. So she was prescribed some sleeping tablets.
Did that help her?
Uh, no, exactly. So she told me that after that appointment, she left feeling worse than she walked
Mm.
in because now she wasn't just exhausted, but she felt like she was going mad. So they
Mm.
they were not listening to her symptoms, and obviously she didn't want to take the pills because she said that there must be another way to solve these problems. And many women, what I see is are being told that there is nothing wrong when actually there is a lot going on.
Mm.
You just have to read these tests, even a full blood count properly or with a different eye. Let's put it this way.
What do you mean by reading them properly? What exactly do you refer to that by?
Yeah, that's a really important bit because there is a massive gap between the medically normal range and what we see in standard blood tests and what the
Mm.
GP or the doctors say and optimal reference ranges. So even if you are within the medical normal, you might feel unwell. And
Mhm.
so when your results come back like normal, then it often just means you can't be diagnosed with any medical condition, but it
Mhm.
doesn't mean that those are optimal for you.
So the same number, as you are saying, can mean two different things or many different things depending on how you read them.
Yeah, yeah, basically, that's what I mean. So in functional medicine, we use a narrower evidence-based optimal ranges, and
Mhm.
that kind of changes everything. So I can mention an example like for the thyroid, it might be normal on the paper, but if your free T3 is shifting to the bottom of the range, then that might not be optimal for you.
Mhm. What about were there any other signs for her, like fasting insulin, for example, and I think as vitamin D? Did they check iron and all these things?
Uh, yeah, her fasting insulin and glucose was actually normal, but when
Mm-hmm.
we checked the 3 months, the HB1AC, which is the 3 months of glucose, then it showed it was on the upper side of the range, and her vitamin D was normal again. Uh,
Mm-hmm.
but that was the normal level where you are surviving, but not thriving. So
Mm-hmm.
yeah, these were what we found in the blood test.
Mm-hmm. And then normally these would mean that everything is fine, as you are just
Yeah,
saying, right?
absolutely. Yeah, exactly.
Mm-hmm.
Exactly. So that's where we started.
Mm-hmm. Mm-hmm. So what did you actually do with her? Did you
Um,
start her on hormone support therapy or anything, or what was the first step or the next thing happening?
uh, no, no. First of all, I think it's really important to say that hormones are medical territory. So hormone
Mm-hmm.
replacement therapy, that's a doctor job, not mine,
Mm-hmm.
not part of
Mm-hmm.
functional nutrition or functional medicine. So I just want to make clear that HRT can be helpful for a lot of women. I'm
Mm-hmm.
not against it, but we actually follow a different approach and we try to put the basics in place before
Mm-hmm.
they use HRT, for example.
Mm-hmm.
So I
But then,
usually refer clients to a medical doctor if we assume that she could benefit from an HRT.
okay, so in this case, you referred and worked with the doctor on this.
First, we started working on the foundations, and
Mm-hmm.
then at a later stage, yeah, she had an appointment with a medical doctor who offered her some HRT, but that wasn't my scope of practice, obviously.
Mm-hmm. And what do you mean that you started with the basic, the foundation? What exactly was that?
Um, so for the hormones, they don't work in isolation. They need the right raw materials, kind of. They need the right nutrients, a stable blood sugar, good sleep, and a functioning and an optimal working gut. So if
Mm-hmm.
those foundations aren't there, even hormone therapy won't work as well as it could if they are. So uh, I always use this analogy that it's like putting premium fuel into a car that has flat tires. You won't get anywhere. So first you have to replace the flat tires and then put the premium fuel, kind
Yeah,
of.
that's a very great analogy. Sorry for interrupting. So what was the basics that you did for Sarah then?
So we started with blood sugar regulation. That was
Mm-hmm.
the number one. Um, we looked at her food diary. She was
Mm-hmm.
skipping breakfast, running on coffee until lunch, and then having lunch on the go or at the table looking at the computer, and then obviously crashing mid-afternoon. So her blood sugar was kind of on a roller coaster all day.
Mm-hmm.
So and that made her sleep worse, which is a dot we always have to connect.
Mm-hmm. So you're saying that her blood sugar was causing the sleep problem?
Yeah, it was one factor to contributing to her sleep. I know it
Mm-hmm.
sounds weird for some, or many people don't think that eating on regular times and not in the right amount and composition might affect sleep, but it does. Uh, so when your blood sugar drops in the middle of the night, your body goes kind of into emergency and releases cortisol to bring it back up. And cortisol at 3 a.m. means you will be wide awake and your mind racing.
Mm-hmm.
So I think
Yeah.
that can, yeah, resonate with the loads of people.
Yeah, I was
So
just about to say probably yes.
yeah, absolutely. So the first was that we stabilized her meals.
Mm-hmm.
Uh, we put protein at every meal, starting with the breakfast. We balanced her plate and also tried to address the nutrient gaps like magnesium, vitamin D, omega-3s. So these are these building blocks her body desperately needed, but wasn't getting from the food or for the supplement. So these were the simple foundational changes. As you see, no extreme diets at this stage, no calorie counting. Um, so these were the foundations that made also the hormone therapy work better when she later, a couple of months later, she had one.
So as you're saying, you set up certain behavioral changes which she can sustain longer term, and that really helped. Is that correct?
Yeah, absolutely.
Yeah.
Absolutely.
And,
It's not like a strict diet you keep for 1 or 2 weeks. And
Mhm.
so we always try to find an eating pattern and eating composition that works for you and for your lifestyle.
And how quickly things changed for her?
So, as far as I remember, within 2, 3 weeks, she started sleeping
Mhm.
through the night, which was miraculous for her. Still not every night, but most nights, and that already changed everything. She was obviously less tired, less moody, and it gave the opportunity for her body to repair, for the hormones to be regulated in a better way, and her cortisol level calmed down a bit. So sleep is a foundation, and
Mhm.
everything builds on it.
Mhm. And I'm guessing there were other positive symptoms or developments coming out of the sleep being better.
Yes, obviously. Later, the brain fog had lifted as well,
Mhm.
and yeah, she said that she feels that she can actually think again,
Mhm.
uh, and she didn't even realize how much he had lost until it came back again. So that was another achievement. And by
Mhm.
3 months, also her weight started to shift
Mhm.
a little bit. And just because her body was finally working with her and not against her, and
Mhm.
her insulin sensitivity improved. So when we checked her blood sugar level, the 3 month blood sugar level, it went a bit down. Her energy stabilized. And another thing I have to mention here, that she stopped craving sugar at 4 p.m., which again a very very common thing with us women, and it was all because her blood sugar was stable, more stable than before.
Mhm. And you are saying that is from just having the breakfast and the balanced meals set up properly
Uh,
for.
yeah, these things from the foundation and
Mhm.
filling the nutritional gaps, so the extra supplements,
Mhm.
vitamins that was needed. And that's the thing about the perimenopause. Your body is going through a massive hormonal shift. And
Mhm.
if the basics aren't in place, everything gets wobbly. So if you fix the basis, a lot of symptoms try to get better. I'm not saying that they will be resolved immediately and fully, but they try to shift. They will shift into a better place.
Mhm. Did you retest her afterwards at any point in time?
Yeah, we did. As I said, we checked her blood sugar levels regularly.
Mhm.
Um, and we also checked her thyroid markers that they shifted after 3, 4 months into an optimal range. As I said, it wasn't like fully out of balance medically,
Mhm.
but they moved to the right range. Um, Her vitamin D level improved as well, and also her inflammatory markers improved a bit. Um, so the same test that told her you are just fine 4 months earlier now showed
Mhm.
it not just fine, but optimal.
Mhm. It's amazing, isn't it? You are doing the same tests with a different approach, and you have a completely different story, isn't it?
Yeah, yeah, absolutely. It's a completely different story if you look from or with a different eye. Um, and I remember she told me after a couple of consultations that why didn't anyone tell me this before?
Mhm.
Why did I suffer for 3 years or for
Mhm.
2 or 3 years without anybody telling me that the same test can give different results and they can be improved actually.
Yeah, that sounds like a very powerful message, isn't it?
Yeah, and that's the reason why we do this, also these little videos and also the consultations, because I think nobody should have spent 2 years being told there is nothing wrong with her body when
Mm-hmm.
asking for help. So you just really need a different eye
Mm.
for these symptoms, and you can get help or support.
Yeah, that's pretty amazing. Thank you for explaining that. So, Agnes, if anyone is watching this and they think, oh, that's me, I am the one waking up at 2, 3 o'clock at night, all my tests come back normal, but I still don't feel well, what do they need to do?
First of all, it's important to know that it's not you and you are not going mad and not just imagining
Mhm.
these symptoms, and you are not broken. It's
Mhm.
menopause and perimenopause. It's not a disease, it's a transition period. It's a
Mhm.
transition, your body, and yeah, it's a transition phase where your body needs the right support.
Mhm.
And that support, in my understanding, starts what's going on inside and not just guessing, but testing and look at the tests with a different eye. And from a functional medicine perspective, there can be support.
Mhm. And what's the first step if they would ever want to work with you, maybe?
The best start is to book a free discovery call.
Mhm.
Uh, The link will be in the description. And it is a no pressure conversation where we talk about what's going on, what are the symptoms, what they are experiencing, and we discuss whether we can help. So yeah, that's the starting point, and we always take it from there.
Yeah, and I do encourage all of you to do that or consider doing that. Because we do hear this from clients, isn't it? That I wish I have known this sooner. Um, it is an amazing change that can be achieved together with the clients based on some recommendations and talks and guidance from us to these clients, isn't it?
Yeah, absolutely. And yeah, thank you very much for listening to this client story, and hopefully
Thank you
see
for,
you in clinic.
yeah, thank you for explaining, Agnes. Thank you.